Okay, I'm kicking it off again, okay? Sorry about that. Okay, bye. Hi everyone, sorry about that. I think we got kicked out for some reason.
Okay. That said that someone else tried to start a meeting with the same account, which put us all off.
Okay. All right. Okay. Let me deal with that. So let's wait until we've got everyone back in, and unfortunately, people are going to have to ask their questions again. But let's wait until it's at full capacity again.
I thought it was something I said.
Okay, I can remember a couple. I can remember like I think I can remember one or two of the questions at the top. So at least we can start with those.
Yeah. Okay. Let's
so
just give it. Let's just give it a second, Jay, because we've got 404.
Oh, hang on. Oh, that's well. The first question I remembered is the first one in there, but I wonder if they're coming back in. All right. Well, let's see. Whoever was asking in the chat there, have you missed very much? No, you've missed us all going, how did the meeting get bumped? And coming back in. So we haven't, yes, we are all just getting back in.
Yeah.
To see there's questions coming back into the Q&A.
Yeah. Let's just give it a second. Sorry about that. Spencer broke the internet. Dawn, can you get me that on a t-shirt, please? I would absolutely love that.
Right, are we all back?
Yeah, we're just waiting. We've got 448 participants, so they keep on coming in. So let's just wait until we're at capacity.
And the Q&A has been preserved, has it?
I don't know. We've got possibly there's 29 questions in the Q&A. Whether they're being re-entered or whether they've been restored, I don't know. It looks, the first question, the one that I remembered, is the same one at the top of the list. Well, second one on the list now. There's an abridged one from Enric, which just says hi all at the moment.
Yeah, and we're recording everything, so hopefully that's recorded and we can just kind of merge them together. I'm sure we've got a fantastic editor on here somewhere.
Okay, I think we've got 468.
Okay, let's crack on then.
Let's crack on, given we've got an hour and 22 minutes. I'm not sure what happened there, guys. Sorry that we all got booted off the call. We may have lost your question in the Q&A. There are 39 questions in there at the moment. If you were waiting to have a question answered, please check whether your question is still showing. And if not, if you could re-enter it, please. Very sorry about that. So what I was going to say, just finishing off from that last point about legality and risk assessments, in the summary of the government guidance at the moment, point 2 is that all employers must carry out a COVID-19 risk assessment in consultation with workers or trade unions. So there is that is part of the kind of the government guidance at the moment, that risk assessments will need to be undertaken. Moving on, so from Anonymous, in the BFC Commission COVID-19 draft, point 21B suggests the role of third ADs and PAs are to be considered non-essential on set now. Is it correct? And so what happens now? No, that's not quite correct. An earlier draft on that section suggested that in the department only the first AD and the director, they've lumped directors and first AD, directors and ADs into their section, that only the director and first AD would be on set. We've noted to amend that, so the third ADs remain on set. Each production will have to put together its own risk assessment in terms of how many set PAs are used and how they are used. But no, it's not right to suggest that third ADs are considered non-essential or PAs are considered non-essential. Robert Smith, other areas of the entertainment industry are considering taking on an infectious diseases officer or public health officer which could oversee productions or entire studios. As none of the ADs or medics, none of their ADs or medics or anyone in production have qualifications in infectious diseases, would this be a good idea for a film and TV? Hang on. sorry, just the chat's jumping around. Does anyone on the Inward Investment Group have expertise in infectious diseases? I can't answer the follow-up part there, Robert. On the first part, the recommendation is to have obviously the COVID-19 health and safety officer on board, and there will be training available in terms of risk assessment for that role and managing the risks associated with that role. In terms of the next level of infectious diseases control, public health officer, don't know about that at the moment. That's a higher level still, which I can't give you any more information on at this stage. Paul, Spencer, if you want to jump in on any of these, please do, and otherwise I'll just keep going through. Gareth Thomas, is testing going to be part of returning back to production? It depends what you mean by testing, Gareth. Like I said, I don't think there's going to be COVID-19 tests available for the production team or the medical staff and production teams to take out. There is likely to be a health questionnaire or health declaration regarding COVID-19 to be filled out before starting work, and we've commented back that should be after contracts have been issued, before starting work, so there's no discrimination on the basis of someone losing a job because of something that's on a questionnaire. And there's also talk of monitoring. At the moment, the favoured system is obviously following the guidelines on what is a symptom and temperature checking on set, suggestions of even as much as twice a day on set to detect any oncoming symptoms as early as possible. As we all know, it's up to 14-day incubation period. You could feel absolutely fine, had no known contact, but you may still be carrying it, which is why the best practices and safe distancing are still very important. This is all about minimising the risk to all of us at work. Marcus Collier, my question is, how much are we going to be led by insurance requirements? As I understand it, and then please jump in here, Paul or Spencer, insurance companies are not providing any insurance for COVID-19 related matters at the moment. We are ahead of what insurance are saying, because they're not asking for anything that could indemnify themselves. Is that right, Paul?
Do you want to come in on that, Spence?
Yeah, just so there is a discussion at the moment in terms, because there is a group that's looking at contract business law and the insurance side of it. So they're looking at a particular model. So I don't know if you've seen what they've done in Austria and I think France as well. So Macron has introduced a government-backed insurance scheme so that certain industries can get back up and running. The industry is looking at that, so whether they can introduce an insurance-backed scheme that's supported by the government. So there is conversations going on at the moment with the DCMS about whether they'd actually support it, because I think the bigger studios and the streaming services can afford to actually the insurance to cover these situations, but the smaller lower budget productions are going to probably struggle in terms of getting the adequate cover. So they're looking at whether they can get some support from the government. So that's the conversation that's going on at the moment. So we just have to keep an eye on that one. I think in terms of this particular document for the BFC, that is for the high end, so it's for the major motion pictures and for the high end TV, and they feel confident in terms of the level of cover they've currently got for these particular circumstances at the moment.
Okay, thank you, Spencer. So moving on, Howard Davison, I do hope there'll be a third-party COVID supervisor, not a crew member, and can there be a COVID hotline? We very much agree with you there, Howard. That is, the responsibility of the COVID supervisor should not fall to a crew member or any member of the production who has another job on that production. That is our position. As for a COVID hotline, that's something that would need to be looked into separately. But we believe the workload for the COVID supervisor would be so great that it would be impossible for another crew member to take that on. And as assistant directors, we know often where production will turn to first in those situations. They say, well, can't you look after it? And we are firmly saying that's not something that we should be taking on, or any crew member. Lindsay Attenborough, I'm an assistant director I'm assistant directing a feature film that's been postponed due to coronavirus. Is July a realistic time to commence production with new guidelines? Don't know. Can't answer that, I'm afraid. It's going to depend on the production company and how organised they are and proactive they are within this. Are you able to, Alexander Jacob says, are you able to give broad strokes idea of what safe working practices might be? Okay, very broadly. So obviously everything goes back to government guidelines and everything goes back largely to social distancing. So if we just look at that point for a moment, there's gonna be, the measures come a lot down to isolating cohort working, so smaller groups working together, workflow on set being managed so that only those cohorts are working within a set together at any one time, and then the set's handed over, enhanced cleaning measures across the set and all areas. There's talk, the Norwegian system, I was listening to, listening to a podcast this morning about the Norwegian system on the Film Gods podcast, where they're working a zonal system where zone 1 is everyone who needs to be around the camera, zone 3 is everyone who's standby and off camera, and then they have an offset zone, and in between those, zone 2 is a disinfection zone. I've asked for them to send me some details about how that protocol might work. It's an interesting idea, but essentially what it's going to be a lot more considered working. It's not going to be everyone piling onto set trying to do the job as quick as possible all at the same time, and that's going to have knock-ons in terms of the amount of time or the amount that we'll be able to shoot on any one given day, because of the additional processes in place. I hope that gives you a beginning idea, Alexander, and please, when the document's available later this week, have a look through it. It'll give you a lot more detail. Sharon, when do you think realistically film production will start again? I can't honestly give you an answer to that at the moment. I think we need, like Paul was saying, the union aren't going to be recommending that anyone goes back onto production work until there's a clear set of guidelines in place. So it's going to depend somewhat on the BFC timetable. Is that right, Paul?
Yes.
Yeah.
Yes.
Rebecca Jarvis, is there something to share with non-members so there's some clarity on the news articles about soaps and dramas being greenlit? The document will be available to non-members. It's a public website, so that will be available to anyone working in the industry when that goes live this week. There are some other, there is another document going around from the TV producers regarding soaps and the like. I don't know where that's available. Will that be part of a repository on that web page, you think, or of other documents from the industry? So,
what our plan is at the moment is we're going to be circulating the Bectu document, and I'm just going to share my screen now. We're going to be circulating the Bectu document on a very specific web address. I don't know if anyone can everyone see that? Jay, can you see the screen with the web address?
Yeah, I can.
Yeah. Okay, so that's the web address that's going to be posted on the Bectu website. So please do write that down. It's bectu.org.uk/COVID-19, all one word, return to work. That's where we'll be posting the Bectu page. We're also going to be, I'll share that screen a few more times before we finish. There are going to be other documents that we'll be sharing. We haven't decided exactly which page we'll put them on. We will probably put links to them on that page as well, but I know that some departments are also saying that they want to have specific pages for them, and we're discussing exactly where we'll put those. But the answer is they will all be on they'll all be on the Bectu website, or they'll be signposted through the Bectu website.
Great. So I'm going to find that link for that podcast. I know a few people are asking. Just bear with me. So Chris, the APA guidelines specifically exclude waivers for liability. Is this addressed included in the doc? It's not addressed in our doc because the advice that we've had from health and safety bodies is that there is no waiver of liability in law in this country. You cannot waive away your rights through a waiver. Can you expand on that at all, Paul?
Well, I mean, we do settlement agreements all the time, and one of the things that you can't sign a contract that says that I can't take out a personal injury claim, for instance. So it's not something that you can't negotiate in the same way as I can't sign a contract that allows someone to murder me with impunity. You know, it's not a right. It's not a thing I can give away. You also can't sign a contract with an employer that gives them the right to injure you in any way.
Okay, thank you. Louise Allen says, we have had an issue within Scotland with information being regional. Many of us work in London also. Could information within regional groups be made national also? I sort of understand the question, Louise. I think the plan for this document is that it would apply to all film production. Thanks for those who found the podcast link. Those who are our document, the Bectu document and the BFC document would be a nationwide set of guidelines. So they would cover the whole industry, obviously anywhere in the country. Obviously, the variations in local government guidelines are sort of slightly out of our control, and I think in any territory that you're shooting, the local government guidelines should be the ones that you refer to. So if you're shooting in Scotland and the Scottish government's advising things that's slightly different from Westminster, involving England and Wales, for example, then you should defer to the local territory. Hope that answers it. Mark Wiggins, what is to stop employers discriminating against members with underlying health conditions such as asthma and high blood pressure if they think they are too much at risk? Over to you, Paul, on that one.
The issue, there's a number of issues that we need to discuss in our discussions about terms and conditions, because that's a terms and conditions issue rather than a specific safe working practice one. So there is going to be the question, for instance, of are people going to be not offered work on the grounds that they have a vulnerability, or that because they're subject to any self-isolating requests due to a member of family's illness, or indeed an illness of their own. That's a question. That's an industrial question that we're going to be discussing with our branches, as is the linked question of what happens if you're contracted to go on a job and you're forced to contact the production and say, I can't come in tomorrow because a member of my family is showing COVID-19 symptoms, or because of anything else, or if you've got the symptoms yourself. Those are questions we're going to address, and we're going to be looking at what sick pay provision. That's for a separate meeting. It's not for this one, but we will be discussing it, and we are scheduling a meeting on that. Spencer, have we got a date for that? I'm not sure if we've finalised the date on that yet.
We haven't put a date in the diary, but we've committed to actually doing it. And you're right. The thing is, there's lots of issues that are going to come out of this as a result of people going back to work. So we do need to address those. But the thing is, it won't be part of the document that we're doing with the BFC, because that's just about, if you do go back to work, what are the safe measures about mitigating the risk. So we'll have to do that separately, and we'll post that out. Hopefully we'll get something out this week in terms of when we're going to do that meeting.
Thank you. So just looking at there's 88 questions in the link now, and we've got just over an hour left, so I'm probably not going to get to everyone. Apologies, but we'll do what we can. Enric says, can you say whether intimacy scenes will be included in your guidance, since at present many intimacy coordinations are at present part of the chaperone branch until our own opens? We haven't delved into that yet. Chaperones have dealt with the child licensing issues. Equity are dealing with cast and performance issues. So that's not something that we've been able to deal with yet, but please talk to your branch about drafting something up. We can always insert it into the document.
Sorry, Jay, can I just come in on that?
Yes.
Yeah, so we've been in touch with Lizzie Talbot and Yarit Dor. So if you do want to drop me an email, that's absolutely fine. If you just PM me on here, Enrico, and then we can go from there. Thanks, Jay.
Okay.
And
Lindsay said
that's PM Bectu Comms. on the chat function if you PM Bectu comms.
Lindsay's asking, you were saying when the document will be available, please continue. I think that by the end of this week on that website, we're saying, Paul, aren't we?
Yes, I hope so. Yes,
Yeah,
it's
okay.
just a matter of getting the versions right.
Fine. Will there be a push on productions to reduce working hours so that crew do not get tired and complacent with health and safety measures? That's certainly one of the suggestions because of the extra duress. I think more shooting days to create to finish the same script. Certainly, we don't want to be getting into increased working hours because of additional measures. In terms of a push on productions, I mean, we haven't got a campaign in place for that yet, but I think that will come out. That will be something that can be addressed in the terms and conditions and industrial relations meeting, right, Paul? In terms of working hours.
It is going to be an issue because one of the I know that working hours is that people are going to be expected to do. There's a lot more of stuff that I think we could put under the general heading of kerfuffle that involves safe working practices, isn't there? So I think the idea is we are going to be talking about the industrial terms and we'll be talking about hours as part of that. But I think the idea that they're going to be able to get a straightforward 11 hours straight shooting in these circumstances is a difficult one. So that's one of the issues that will be coming up in our discussion about industrial terms and conditions. Yes.
Working hours are really important though as well, Jay, because the thing is, in terms of trying to mitigate, some of the risks, we don't want people who are tired, who are going to make mistakes and, have accidents and, so the thing is, it will have to figure quite highly in terms of the discussions that we do have, with productions about, the working hours. And I know some of the productions are already talking about in terms of split shifts and those sorts of things. Because the thing is that they're going to need, large crews, but they can't bring in large crews because obviously the social distancing or because the stage just doesn't allow in terms of, that volume of people. So they're going to have to do different ways of, engaging people. So that is a conversation. It's a really important one I think we need to have, with productions. So we will be picking that up.
Great. Mervyn asked, will temperature checks be carried out before work starts on each day? That's certainly something that is being looked into. But there's nothing firm around that yet. Martin asks, will extra skills be required for risk assessors, or does existing legislation rule cover everything we'll need to put in place? I know Martin Roberts at Bectu and some other providers are putting together specific COVID-related risk assessment training. I think if you're already an experienced risk assessor, it will, it's something that can easily be picked up and added to that which you already know. Much of what, as going through this, much of what we discovered is that a lot of this comes down to common sense, and some of it then is just a bit of lateral thinking in terms of how you implement safe working practices on that.
Yes, we are. I mean, as a union, we are looking at with we have plans in place. We're not in a position to announce them yet because we've got to cross a few T's and dot a few I's. But we are planning to offer direct training that's large numbers of people will be able to go on in terms of both picking up the initial risk assessment skills. So for people who haven't got experience of doing risk assessments before, but then also for people who have got experience doing risk assessments on how to do them in the context of COVID-19 working. And we hope to be announcing something on that as soon as we can.
Okay. So Anonymous asks, are producers and production companies involved in these conversations? Because ultimately they're the ones who will be responsible for implementing the necessary precautions and regulations. Yes, they're very much involved in the BFC document and the BFC consultation. They haven't really been part so much of our document. That's more branch-led and craft-led, so from the crew side. Gareth asks, is this document going to be given to production companies as a guideline of how to work? Again, the BFC document will be an industry-wide document that will be available to all production companies. Our document, in terms of how that gets disseminated, is a backup detail to that. I mean, Paul, is there a plan that it could be sent to all productions starting up as a document?
I think I mean, if we want to disseminate it, we certainly can, and I could talk possibly. I've been in conversation with Kays, who have a directory of companies, and we could send it out through that route as well. So yes, I don't see any reason why not. I think that's something we'll probably want to do next week. We'll want to make. I think we should probably wait until the BFC document is published on that.
So I've just seen a comment from Barbara. It produces. Oh yes, there is the WPD branch which has been involved in the BFC document consultation. So they are involved. Jonathan asks, are you in touch with other territories that have started back, e.g. Australia, NZ, where food productions have started back? Spencer, can I, because obviously you're the UMI and FIA connection. There's a bit of contact there, isn't there, with other territories?
Yeah, we've spoken to most of them. So there's a Uni Global, which is an organisation that feeds into all the unions around the globe. So the big ones really are, IATSE in America, Directors Guild in America, and Directors Guild of Canada. But we're also talking to Verdi in Germany, talking to the MEE in Australia. So we are talking to loads of different unions across the globe, and trying to learn in terms of what they're doing over there, because some countries are opening up quicker than we are, because they entered this crisis earlier. So they are doing certain things that we could potentially learn from, and we are we're sharing what information we've got, and they're sharing equally the information that they've got. One of the things that came back certainly from Germany was that the health and safety, they were saying that if it's really, really complicated, so in terms of the document, this is one of the things we need to be careful of. If it's quite granular in terms of the information, productions and the crew weren't observing it. If it's quite straightforward and it's easy to follow, and it's being led by those particular crafts, people were following the guidance. So I think there's a few lessons to be learned in terms of what other countries are doing. But we're certainly connected up with most of the other countries. And I think, Jay, you joined. We flew you all the way by Zoom the other day. So meet up with some of the other unions.
Yes. There's a lot of, yes, there's been some talk between you, as Spencer said, and so there's a global cooperation going on this. Can I just say, as we pass the halfway point, if any of your questions are duplicates, if they've been answered by somebody else's questions, if you can delete them out of the Q&A window, if that's possible, that would be really helpful, because we've got 93 questions and 57 minutes, and that doesn't quite divide. Blue Ryan asks, please could you outline the insurance/indemnities that a production company should have in place for documentary and factual? Sorry, at the moment, no, I can't. That's going to need more work and we need to look at that separately. Edward asks, is there a time frame in mind before an agreement could be in place and we are able to return to work? I'm in electrical rigging. It depends which sector you're looking at the moment. APA and commercials, APA are being very kind of forceful in their position that it's safe to return to work, which throws up a whole other set of discussions. So commercials are coming back already, or starting to go into production already. In terms of the BFC document and feature films, as we said already, the timescale is that the consultation ends on Friday, and then they need to bring together all of the feedback from their consultation before submitting it. And I think Spencer said possibly they're aiming for the end of the month to get that in. So that's as much as I can tell you on that. Ian says, do you think we need to be careful not to recommend too many safety measures that will restrict productions coming back? Is there a fear that it will make it uneconomical to shoot? It's a valid fear. It is, again, all of these are guidelines, and productions will have to scale the guidelines to their to their abilities. But what I would say is that in this situation, there needs to be very any sensible production isn't going to put anyone in harm's way because of a financial issue. So it's going to take a little bit of lateral thinking and working out how they work safely within within their remit. I hope that's, I mean, it's a bit woolly as the government is, but I hope that answers things. Paul, do you want to add anything to that?
I don't think there's anything we can add. I mean, plainly, we have members who have real concerns about their own safety and their family's safety, and we have members who've been very badly let down by the self-employed and the other schemes that are open to keep freelancers supported. So I've spoken to members who've said both things in the same sentence, saying I'm really worried about the safety issue and I'm also desperate to get back to work. And I think it's a terrible situation to be in. What we've aimed to do by producing this document, the aim has been to be able to get people to get back to work as soon as is safe. And I think that without these kind of guidelines in place and without this kind of agreement as well, we would end up going back later than we should. So really, by going to into the detail that we have done, we've done everything we can to sort of get the best of both positions, even though I think it's such a horrible situation. There isn't the best of both worlds. It's the least worst of both worlds is the balance we've tried to strike here.
Okay, thanks, Paul. Andrew, I'm just going to abbreviate your question. I think the essence of your question is, can Bectu put out a public statement on the members' behalf? I know that there was a statement that went out a couple of days ago, Spencer, to all members. Is there a plan to make to do a public version of that statement?
Well, we can put it on the website and make it publicly available. I think we've been quite clear in terms of what our position is about returning to work, and I think we've reiterated that on this call today. We're saying that people shouldn't be returning to work until there are a clear code that we're satisfied with, that's been through the HSE. Once all those measures have taken place, then I think then we have to monitor it, and I think that would be the next stage. But in terms of statements, that's our position. We've made it quite clear in terms of what we think should happen and what the steps are.
And Andrew's just sort of comment, he's added to the comment, sorry, I had to abbreviate, Andrew, is the statement that could be written by the members from a joint meeting. I wonder if that's something that could be looked at in the T's and C's industrial meeting when that happens next week.
Well, Andrew, we issued something to members on Monday night. That the words that we put in that email will also be on the page the web page, the link that I've put up on the the link I showed earlier, and we're going to be showing again. So that statement will be there then.
Okay, thank you. Liz, so Lizzie says, is there any production insurance? We sort of said that already, that at the moment insurers aren't insuring anything related to COVID, any disruption related to COVID at the moment. Steve says, in relation to Rachel's point, is there any idea how set construction departments or non-shooting crew will be able to social distance, especially working at height? Yes, there are some mentions of that in the document. Talk to your branch if you have any feedback on that. Obviously, if you see the document and you feel anything's missing, speak to your branch about getting updated guidance in there.
Jay, sorry, can I just come in on that?
Yes.
So the people who are representing the rigging branch on the British Film Commission working group is Ricky Harris, Matt Schofield, and Brett Jaffray, and it's also okay to speak to John Pitt. So yeah, they'd be the people that you need to ask. But they have been feeding into this document, haven't they, Jay?
Yes, they have. James says his work is mainly in the locations department. Will there be any information in the Bectu document for that department? Yes, simply speaking, yes. There's quite a lot of locations information in there, James. Riaz asked, who are the Inward Investment Group? That is it's the BFC, British Film Commission Group. Inward Investment is a term related to the major motion pictures that come in mostly from the States. So it's that money coming from overseas to do film production in the UK. There's a question here. Any thoughts about interaction with actors, performers on and off set? Yes, lots of thoughts, particularly a makeup department and hair and makeup department and costume and wardrobe department particularly have done an enormous amount of work on this. In terms of on-set performance and the like, Equity are really taking the lead on performers and actors. Shafali asks, will there be extra measures in place for those people with underlying conditions, for those of us shielding? If the government tell us to go back to work, I think many of us will also be nervous about recommencing work. How can we ensure we're safe? The situation, this is a tricky issue with shielding. I mean, at the moment, the government aren't recommending those who are shielding to go back to work. Is that right? Have I understood that right? And the measures, I mean, the measures in place on set will be there to keep everybody safe. It's as much as I can sort of say on that at the moment. Do anyone want to jump in and add to that?
I think you've probably covered it there, Jay.
Okay. Right. Kenny asks, what's your position in Scotland? Your doctor's not mentioned drama directors. Will it have any advice for them? Are you working with Directors UK? We haven't been working with Directors UK. What's the union's position in Scotland?
So the document's been shared with Creative Scotland, so they're feeding into the process. Funny enough, Creative Scotland actually asked for the comments to see a draft of what we discussed the other day before they do the submission. So I presume it's going to probably mirror what we, you know, what the changes that we recommended. So in terms of Directors UK, so there is a federation of entertainment unions, which does include Equity, the Writers Guild, and some other entertainment union as well. We've extended that slightly. So DUK is involved in that, and they are feeding into the process. So they have submitted something. I haven't seen in terms of what they've put exactly in regards to directors, but they have submitted their own submission on that.
And I'm just to pick up on Kenny's middle point, it says your doctor's not mentioned drama directors. If you're referring to the BFC doc, that's because they're looking at that major motion picture scale. We haven't got a directors section in our document yet, which would be WPD branch to contribute, as would need contributions there. Rochelle says, I hope I've said that right. Is there a protocol for reporting a production which claims to adhere to safe working environment, but on the day seems to be lacking? Not yet, but I think, I mean, it would be encouraging anyone who feels they're not being properly protected to contact the union, I would have thought. Paul?
If you, I mean, you'll have guidance on what should be in the risk assessments, and if you feel that safe working practices have not been applied, then absolutely, we will be asking people to contact the union.
Chris says HA's public liability has been included. Just slash discussion question mark.
Has public liability.
Oh, sorry, has public liability been included slash discussed? Has Bectu discussed this with the insurance providers, and will they cover it? Can I get one of you two to deal with that?
Do you want me to pick it up, Paul? So the PLI insurance is a third-party type of insurance, so it's about accident or injury to a third party. So we have discussed it with our insurers. It's still valid, so it's still covered, you know, during this, you know, crisis. And as you probably know, we've extended a 2-month free period just recently, just because of the circumstances. But the actual cover is remained the same. It hasn't been amended as a result of the pandemic.
Okay, thanks, Spencer. Lindsay, US unions are scaling down their crew. Where do you stand? There's a tricky dichotomy in this whole process, in that one of the simplest ways of keeping more people safe is to have less people on set. Not saying that should be less crew on set, but there are some, certainly in when you look at commercials, agencies, clients, and exec producers and that kind of thing, who don't necessarily need to be on set. So in terms of reducing the people who come into close interaction on set, yes, supporting that. But obviously, the more measures you put in place, potentially the more people you need to complete those measures. So there isn't a simple answer to that one. I think it's more about keeping people zonally on set and keeping people individual interactions down to a minimum. Sean, it says, okay, sorry, yes, Sean, I think your question got deleted on the first thing. So hair makeup, need to know if expert cosmetologists and packaging specialist specific knowledge are being consulted. Bectu need to point the way with the BSc and HSC on this, surely. Yes. Now, the hair and makeup branch have been doing a huge amount of work. They are, as Bob couldn't make it onto the call today, but she says they are starting talks with government bodies for health and safety in hair and beauty industries. They couldn't get onto this meeting today. They'd like to set up a separate call just for hair and makeup branch. So that is being, advice on that is being sought. Katerina, what factual and wildlife, obviously productions in, so most productions in Bristol fall into this category. It's not covered in our current document. No, it's not. Should factual wildlife unscripted wait for specific guidance to be issued them, or are they encouraged to adapt the guidance for scripted and resume to? Yes, you are very much encouraged to take the lead. You're the experts in this field. I know nothing about factual wildlife unscripted production. So you're very much encouraged to take the lead on that because you know what it involves. And please adapt and use chop up, adapt, copy, paste, whatever out of the document is useful for you. Felicity asks, I have access to an antiviral material and clothing for use as PPE clothing for all of us. Can you please point me in the right direction so we benefit from all of this? A makeup designer and need your input where to go. We'll have to pick that up. You just contact hair maker. I don't know actually, Paul. Where should she go?
Yeah, if you go through your branch and contact the Bectu official, there is Jane Perry. If you contact Jane, her email address is jperry, JPERRY @bectu.org.uk.
Thanks, Felicity. Thank you, Paul. Christian, I assume we will be asked to distance departments from each other as much as possible. Yes. I would imagine this would mean a high demand for radios from all sides of the production in order to help crew maintain their distance. Do we think we'll have enough radios to meet demand? And also, who will clean these radios, batteries on a regular basis? Normally falls to third ADs and runners. As to supply and demand, I can't answer it, but I know that, that there are lots. We usually don't have a problem getting hold of radios in the most. Only in the very, very busiest of times, and I think coming out of this we won't be in the very busiest of times. The suggestion is on our document is that there's the central stores for radios which are sorted out at the start of each production, and then chargers, spare batteries and radios are allocated to a member of each department, so that the day-to-day control of those fall within a working cohort and within a department, so we've not got lots of equipment being moved between departments throughout. But there will probably still need to be a central store, and an allocated member from each department would then liaise with the third AD who holds that central store to resupply if there's any faults. I hope that answers your question, Christian. Anonymous asks, what's the thoughts on productions trying to isolate the entire cast and crew in hotels to avoid introducing the virus to the shoot? Could this isolation extend to 7 days a week? And if so, how will the rates be affected? Lastly, should sanitising stations should be introduced? How will you see this being policed and enforced? So I'll answer your last question first. Sanitising stations, yes, they will need to be provided on set and around places of work. They're high. I know some of the sort of facilities hire companies are already investing in these. It will be down to production to source and put those in. Policing and enforcement will be down to the COVID-19 health and safety officer or department under the COVID-19 health and safety officer. As for, I'm sure you've read the Deadline article, there's a talk between two American producers about pre-shoot isolation of crew. I wonder if that's what you're talking about, or whether you're talking within shooting processes. We haven't really delved into that. It's a very difficult issue to know. The two US producers were talking about sort of remote locations in the film model where everybody would hole up in a hotel for 14 days, self-isolate, then come out on day 15 and start work. issues around payment and everything else around that need to be dealt with separately and outside of this meeting. We haven't delved into recommending overall how how a production should work. It's about safe working practices within the production, if that makes sense. I hope that makes sense. With regard to the time frame, Spencer, you mentioned the document will be rolled out by the end of the month. Should we therefore expect our productions to be starting back up by the end of this month too? You want to take that one, Spencer?
Yeah, well, who knows really? All I can do is tell you in terms of where we are at the moment. So the time frame is that it's going to go in front of the DCMS by the end of the month, providing, and I don't know how long the DCMS needs to review the document, because it is going to be quite detailed, because it's going to have lots of input from loads of organisations. So I don't know how quickly they're going to turn that around. It will be turned around sometime in June. And then once it's agreed, I guess that's when they'll be signalling to the productions that they can go back, providing they observe, the guidelines that are in the code of practice. So I presume we'll start hearing that heads of department will start getting contacted. And I presume that will start, if I had to guess, I presume that would be towards the end of June. Heads of department will start getting contacted about, potentially going back to work. But I think different productions will be at different stages in terms of doing that. So it won't be like a blanket switch where everyone would just suddenly go back. It will be gradual, and I think different productions will take different approaches. But I guess by the end of June, we'll start seeing the first seeds of people probably being contacted about possibly going back.
Thanks, Spencer. Just in the chat, DCMS stands for Department of Culture, Media and Sport, who are the government department who deal with our industry. Over 99 questions now. I think probably have to ask everyone to stop adding more questions to the Q&A, because we won't get through all of those, I can't see, in the next 40 minutes. Sorry about that. We'll get to as many as we can. What would happen? So Des says, what would happen should there be a significant variance between the Bectu COVID-19 risk assessment and COVID-19 risk assessment provided by production? How would this situation be resolved? The Bectu document is a guidance with as much detail as can possibly be in there. It's up to productions to provide their own risk assessments, and it's up to departments within that production to talk to the risk assessment should be being put together by the COVID-19 supervisor. So there needs to be clear channels of communication between departments and the supervisor and producers as that risk assessment is being put together. No risk assessment on any production should be put together without feedback from departments or without the ability to feedback and amend from departments. So it's a two-way conversation. Tom asks, if someone was to get sick, do we have to shut down the production? If not, what will be the process to work out the risk to workers? Is there a plan policy in place? This is all to do, this comes back to cohort working. Again, it's a difficult issue, because if one person, the idea of limiting personal interactions and individual interactions on set would mean that if one person comes down with the illness on set, they will, if all measures have been put in place, they will have come into contact with as few other people on that set as possible. Then on a case-by-case basis, it would need to be looked at whether they'd had, whether it then falls into current government guidelines that somebody else needs to isolate because of close contact with somebody who's got a confirmed case. It's a very difficult issue, and one that there'll be a lot of discussion about going forward. Margaret asks, don't know if my question was received. I was saying, I imagine Equity would be drawing up their own document for members. Will Bectu be consulting with Equity? No actors, no production. Equity are doing their own stuff. Spencer, can you elaborate on that at all?
Yeah, I won't spend too long on it, because Equity have been part of the consultation. They've actually already consulted, I think, their members in regards to the document. I think they've either drawn it up and in the process of submitting it, or they've already submitted their recommendations. But they've only done it in relation to the cast. They haven't touched any of the other elements of it, because obviously they're not qualified in terms of those departments. But yeah, they're fully on top of it. They are in the process of submitting something if they haven't already done it.
Okay, Alex. Hi, Alex. How are you? Surely illness as well as health and safety has everything to do with the unhealthy length of days we all work in the industry wide. Is there serious talks as to lowering the working day and making it legal to bully and force people to break our right to 11-hour turnaround? It's a valid point, Alex, but it is that's going to punt that over to the industry in terms of conditions discussion, and that's obviously an existing problem within the industry that needs to be addressed, and not for this forum. Sorry, my friend. Amanda says, I know it's hard to say, but do we have a rough idea when we could be expected to go back to work? I mean, construction, we've sort of addressed that one already, Amanda. We don't really know yet. It will depend on when the BSc document comes out, but over the next couple of months, possibly. Andrew, factual TV is probably going to resume first in the next few weeks. I'm hoping that we can get something sorted for them soon, at least designing a risk assessment. Again, we need those of you who are working in factual TV and who are represented by a branch within the union. You guys need to do it. If you put something together that you're happy with, we'll get it published as part of the Bectu document, right, Paul?
Yes, absolutely.
Yeah, unfortunately, there's a limit to what we can do on your behalf without knowing the ins and outs. So, as with the wildlife department down in Bristol, please put something forward. Maria, what happens to people who have disability who work as crew who have health issues or have mobility issues? Good question. I think this again, it will come down. This will have to come down to the other discussion, the industrial discussion. Paul, you're nodding at me.
That is one of the issues that we're going to have to address in that.
Yeah. So Ken says, first aid. I've seen that there may be a requirement to have a medic on productions. Many smaller TV productions will usually rely on first aiders rather than engaging a medic based on risk assessment. Will this be acceptable if they are given COVID-19 guidance? I'm uncomfortable with this because I think the medic's duties are going to be enhanced on this, particularly if you get into temperature checking and health monitoring and looking at records, and that's not something the first aider is trained to do. So my personal and our branch recommendation was there should be a medic on every set, or at the very least a nurse, but somebody who is properly medically trained to deal with the issues that could be coming up on the on shoots. Could you talk about mention of PPE in the document? Government advice seems to be that it only has a minimal effect on the spread of COVID, and health and safety says it should be used as a last resort. How do we make sure we don't end up over-reliant on PPE? Yeah, again, another tricky one here. I'm sure we can all agree that the government guidelines on this have been rather woolly, and they've just, in the last couple of days, they've just said that you should wear a face covering in enclosed public places, but stopping short of saying face mask because of the supply issues that we all know about. I think our guidelines on this, it's all about protecting ourselves and those on set. It needs more work about PPE and exactly what we need, but for certain departments like hair and makeup, for example, or people who need to work, like sound department, costume department, who need to work in close quarters with cast or other departments, it is going to be advisable for them to wear enhanced PPE to in those interactions. There's also the issue of disposal of PPE, and it's no use wearing face masks if you're going to touch it every 5 minutes. And you can still if you're wearing gloves, you can still transmit the virus by touching your face, even if you're wearing the gloves. So there needs to be training for crew and clear implementation on how that, on best practice on that. That's still being worked out. There are a lot of unanswers in all of this. It's still work in progress. Will standby art directors be considered essential on set, says Anonymous? Yes, I would assume so within but it will depend on the production that you're on and the scale of that production and how that's crewed up, and that will be a production and department crewing decision. Certainly, nowhere is it said that they are not to be considered essential. Thomas asks, will the Bectu guidelines remain a living document after we start back and updated if new practices are discovered or existing suggestions found not to work? Yes, that's the aim. Exactly how that gets updated is to be seen. Obviously, I've been working a lot on this over the last 5 weeks. because I haven't had another job to do. But as and when and if maybe we get back, we'll have to see how that gets updated. Lindsay, how will we work with Bectu on risk assessments? I think I'm not quite sure what you're asking. Obviously, the document that we'll be producing will be there as a resource for you to refer to, and it will be branch specific guidance for you to refer to on those risk assessments. If there are questions about the risk assessments, I would defer those questions in the first instance to your branch, and then take it from there. Jaquetta.
Sorry, Jake.
Yes.
Can I just come in on something? Sorry, just
Please.
to just on the chat. So there's a kind of thread on Bectu PR. So we'll cover that at the end. But if you could just put one succinct question, one of you could put just one succinct question into the Q&A where it will be picked up, because we're not picking up anything from the chat. Thanks.
So Jaquetta asked, hi, as a makeup head of department in the red zone where social distancing is not possible, how might this document and risk assessment courses affect our insurance, particularly personal indemnity? Insurance, I can't really answer on insurance. There's the thornier issue in this as well, in that you can't, it's going to be very difficult to prove in any situation exactly when, if you get the virus, exactly when and how you did. So that's because of the 14-day incubation period. How can you even push back and said, I received it at this point and that person is liable? It's using health and safety measures to reduce the risk of transmission is what we can do. Hair and makeup department done a lot of work on this, and their section in the documents are very detailed. So talk to your branch, particularly insurance and indemnity. Insurance, again, is that thing they're not insuring at the moment. Personal indemnity, I can't really answer. Anonymous, a question about accommodation. Okay, it's a little long, I'll go through it. I personally and others I know are in the same boat. Working away from home, we aren't allowed to stay in other people's houses as accommodation or in second homes, and hotels aren't open. If work restarts before these changes, how will it affect my ability to work? Another question is public transport. Will people be expected to use public transport, or will things be put in place for those who use the tube, etc., get to work? The recommendation is don't use public transport, and that's from government as well. The recommendation within the document isn't to allow for greater facility for private vehicle travel, but public transport to be used as a last resort. And if it is used if you do have to use it, it's about taking every precaution you can in terms of PPE and protection. But the recommendation at the moment is not to use public transport. In terms of accommodation and being away from living away from home, I don't have anything really to give you on that at the moment. It'll have to be a question with production. If production are requiring you to stay away from home, I know there's a push to ideally not put people into overnight accommodation. Obviously the knock-on fear of that is longer travel times, but that's being talked about and addressed, that we shouldn't be increasing people's travel time days because they don't want to put people into accommodation. The health and well-being of the crew needs to be paramount. So sorry, I can't give you more detailed question on the accommodation side of things. Steve says, within our industry, there are certain departments requiring professional, in particular qualified personnel. Given that there's likely to be a bit of a gold rush chasing work as it comes back on stream, what will Bectu be doing to ensure productions only engage suitably qualified personnel where appropriate? Can I throw that one over to you, Paul? I'm
sort of hoping that Spencer will jump in on this one a little bit.
Right.
I think that is definitely imponderable at the moment. Productions are going to be going back slowly. I think that I don't think our concern is that they won't be able to find professionals to do the job. I think that the problem is probably going to be the opposite one to start with, is that there's going to be a large number of people chasing a small number of jobs. So I don't see that as an issue. What do you think, Spencer?
Yeah, I think it's one really not necessarily for, the document, because it's about in terms of, people going back and about, the measures that you need to take in terms of, protecting them. But it is an interesting conversation. I think it is something that we can pick up on, because I think there are certain areas that we can actually push. So, for example, the riggers have got a grading scheme, special effects have got a grading scheme, the grips have got a grading scheme, and there's lots of other examples where we could demonstrate that particular departments, they should be employing, professionals rather than just getting someone in, particularly at the moment where there will be a lot of pressure on, people to go back, and potentially there might be productions who are trying to squeeze some of the terms and conditions. So I think we should do the opposite and say, well, actually, it's a benefit to the production if they do get people in who are, qualified, who do know what they're doing. And I know this has come up from, the FAA as well, where, agents are the gatekeepers to the industry. They've flooded the market in terms of people coming in. So I think it's an opportunity for us. I don't necessarily think it's probably for the document that we're discussing at the moment, but it is an opportunity for us to talk to productions in terms of, the level of, qualified people that, they're bringing in. So it is something we should be picking up.
Thank you. Hermes asked, will camera branch publish guidelines more specific to the camera department? Yes, they're working on that at the moment. How can we, Lindsay says, how can we get COVID-19 health and safety training, or do we need to employ an officer? Martin Roberts at Bectu are working on a training, and I know other providers are also working on that training to be available. Do you think there'll be any, Anonymous says, do you think there'll be any dailies work? And if so, how do you foresee this happening? I think there will be a reduction in dailies work. I know there's been some talk in the industry about kind of trying to crew through the production, or certainly in blocks, so that you're not having differing crewing levels on individual days. But I know that's just theoretical. That's been theoretical chat rather than anything specific from any specific production. Obviously, anyone coming in to a job on a daily basis would need to follow the same health kind of health questionnaire, temperature checks, and anything as anyone else on the crew. So that's where that sits at the moment. Lucy asked about whether productions will be starting this year or not. Again, we don't really know. I imagine some productions will start up this year, but it will depend very much on the production setup and what their scale is, what the script is, and how they're planning on working. And how would it be possible to make a film with social distancing? It still has to be implemented. That's what the document's all about, is how we can do that in distancing. So please have a look at the document when it goes out. Will there be track and trace app for individual companies? I don't imagine so. I think anything like that will have to be done centrally, and with all the controversies around that and the app that's out there at the moment, I don't think it can be put down individually. But I think what you're saying is checking back if someone has how do you track and trace through an individual production, or people who've been moving through productions. Don't know at the moment. There may have to be greater cooperation with agents, diary services, and that kind of thing. So somebody, so the records are kept of when people are off work, isolating this, that, and the other. But that's me speaking completely off the top of my head, and that hasn't been discussed with anyone at all. So don't jump on me for that one. Will the need for COVID health and safety representative be a legal requirement? Don't know. That will all depend on the BFC's recommendation to HSE and what they decide to adopt. Peter says, I know as we were bumped, Spencer was beginning to talk about timescales for documents release. Is your recommendation not to agree to work on productions if they want to begin shooting before documents are released? It sounded like the suggestion was to be at the earliest at the end of this month. Spencer.
Yeah, I think we might have already covered this again, actually. Yeah. So our recommendation is that until the document has, gone through the different stages that we outlined earlier about going in front of the HSE, about it being adopted by the DCMS, until that's all happened, our recommendation is that, people shouldn't be going back to work, because there isn't any, at the moment, there isn't any agreed published statement in terms of the practices that people should be adopting. So until that process actually happens, we're hoping that that's going to be by the end of this month. That's all agreed, and then it's out there in terms of what productions choose to do. But until that actually happens, our recommendation is that that people shouldn't be going back.
Okay. Thanks, Spencer. Ken says, the Lancet says, quote, the risk of transmission with brief contact, less than 15 minutes face-to-face contact, or infection onset after 14 days of exposure to a known infected person, the estimated maximum incubation period, is low and should not be over-exaggerated. What's Bectu's view on this statement, as some other guidance is suggesting that the 15-minute rule is okay? I'm not quite sure how to answer this. Obviously, you have to take the government guidelines as the starting point. I think we have to take every precaution that we can on set to ensure that everyone's safe. And if that means being more cautious than what the government's saying or what the Lancet is saying, then that's what we should do, because we need to look after each other.
There is an article in the Lancet that says that, but then there are articles in other medical journals that are saying different things, and so it's. I don't think we can take a position specifically on that. We have to do the best we can on the guidance, and the BFC are taking medical advice as well.
Okay. Anonymous, what independent oversight process will be established to ensure production's producers do not cut corners and compromise the welfare of crew when implementing the C19 codes of practice? Is it felt that C19 supervisor will be sufficient? How extensive will their powers be? Will there be an independent body crew can contact to raise concerns about what powers they have over production? Well, the independent body would be Bectu in the first instance through your branch if you've got any concerns about how your production is being set up. The extent of the powers will be worked out. I don't know exactly what the extent of the powers will be. We have recommended that it needs to be more than just a supervisor. It actually needs to be a department consisting of at least a supervisor, production support, marshals, medics, cleaning staff. So that's still, the detail of that is still to be worked out. We will have to see what comes down from BFC and from the Health and Safety Executive on that in terms of the legality. Does Bectu have a specialist consultant on COVID that we can consult? Work in Factual and have corona-based shoot for the BBC on Monday. I have been looking at PPE, mask wipes, etc. However, the spec sheets of masks are Greek to me. Having advice from a qualified source with relevant medical qualifications would be amazing. Spencer or Paul, is there anyone that can be contacted on that the union are talking to?
Well, it depends on exactly what advice, I don't think there is any COVID specialist, because a couple of months ago, COVID was an unheard of, term. So it depends on, in terms of, exactly what advice they need. I think in the first instance, they should contact their relevant official if they've got concerns. Just in terms of going back, so there is the broadcasters, they have developed a similar sort of guidance in terms of, back to work plan. So they are talking, so that's the BBC, ITV, Sky, Channel 4. I don't think that's been published, and I don't think it's been fully agreed. I thought it was still in the consultation period. So we'll have to check that, because if they are asking people to go back and they are asking people to work, particularly as soon as next Monday, then I think that would be a concern for us. So that whoever put that message up should probably contact their Bectu official in the first instance. And then we can follow that up, and particularly if you've got concerns about if there's not appropriate PPE or whatever it might be, to raise that with us as well. Because as far as I'm aware, the document that they've been discussing internally, hasn't yet been agreed.
And we'd be very interested to see any risk assessments that they've written on this, because it'll create problems for them if they're not agreeing standards before. If they're trying to get people back to work without having an agreed standards, then what they'll have a situation where people are, where it creates delays that they don't want or need.
Thank you. So Jez and Josephine are both asking sort of the same thing. I'll run through it. So if a crew member is diagnosed with COVID-19, doesn't mean the whole production has to cease for 14 days, as they may have infected others. And Josephine asked, what happens if someone in your team comes down with COVID-related symptoms halfway through a job? Will it mean the whole team gets stood down? It will need to be looked at on a case-by-case basis, depending on the working patterns involved with that department, and the measures. The safe working measures that we're putting to place hopefully will enable productions not to be shut down in their entirety, but it will depend on each case and each scenario and who it is who comes down with the infection. Anonymous asks, will age discrimination be an issue, particularly HODs and experienced crew? Bectu's position is very much that we don't want anyone to be discriminated against on the basis of anything on age, on any basis, and that any health questionnaire should be specifically related to COVID-19. Anything you want to expand on that, Paul?
No. I don't think so. I mean, it becomes another one of that is another issue that falls into the industrial question. You know, it's something that this calls about safe working practices, but it's an issue that our branches, now negotiating committees, should take a view on.
I think the other thing to mention, Jay, is that we haven't actually seen what this health and the questionnaire actually looks like.
Yeah.
I don't think anyone has actually drawn it up yet. So I think we should play a part in that, just to make sure, like you said, in terms of discrimination, so certain groups don't find that they are being discriminated against as a result of the information they're providing. But at the moment, it's a blank piece of paper.
Well, I know the APA have drawn up one in their initial guidelines, which came out a couple of days ago. So their example of that is available. But I'm not going to comment any more on that at the moment. Johnny, hi Johnny, says, one of my concerns is the new job created on set called COVID supervisor. This person who is involved right through from script reads to production will be above directors and producers. My worry is that these will be provided by studios or investors who will then decide who should and should not be sent home. As your document says, cohorts who have had a member be found to be infected, they're all sent home. Surely we will not want this to be controlled by studio or financiers. Also, will this lead to stronger legal agreements we will have to sign to get back to work? Can't answer on the second part of that, Johnny. That would be for the T's and C's question. Sorry, Nia, could you avoid deleting the question until I finished answering, so I might need to refer back to it. So just remembering what you said, John, the health and safety supervisor who picks them, who selects them, and what powers they have, and how do they decide things? Each production will need to implement a clear COVID health and safety protocol with reporting measures, with information on how they will structure, how exactly they will structure their production. And the advice in the consultation, the BFC is dealing with that to a degree. Our document deals with it to a degree, but it will end up coming down to production by production basis. There should be a clear protocol within there to say how they're going to deal with if one person shows symptoms and are required then to follow government guidelines, what the knock-on status of that is. That should be a person who's undertaken training in that field. I think that's probably what may happen if we get back to a decent level of production, is that we're going to the people will need to be sent on that training. So whether that becomes they're going to need to sort of almost employ new health and safety supervisors to fulfill that role, and those people could come from anywhere within the industry. So I'm not sure what else to say. Is there we haven't got into a recommendation on anything beyond that of where that person is sourced from, other than they're trained, Spencer or Paul?
I don't think we've got because I think the groups like First Option and some of the other health and safety advisor groups are going to probably have more of a stake in this than probably anyone else, because obviously they're providing advice and guidance in terms of health and safety currently. So I think they'll probably play a bigger role in deciding in terms of who that is and what training, if any, they need to to carry out that role. So I think we just have to talk to those providers and see what they think in terms of what's required. I think that's the route at the moment.
Last 10 minutes then, folks. Do we need to allow any time for summing up at the end for you guys? Do you want to leave a couple of minutes?
Jay, I think we need to address the PR situation, because there's quite a lot of discussion around it in the chat function. So if you can just take a There's one urgent question, which is about the person who's in the art department who's been asked to go to work in Belfast on Monday. So if we can, they're asking should they go or not. So if we could ask, if we could answer that, then take one more from the Q&A, and then we'll address the PR situation.
So the question is, did you just read the question out for me, please, Nia?
Yes. So hold on. So there is art department work starting on Monday in Belfast. Are you aware of this? Should I refuse if I get offered an immediate start?
I'm going to have to send this one over to Paul and Spencer to deal with, I think.
Yeah, that's fine.
I don't think it's probably fair for us to say yes or no over a webinar in terms of, because we don't know all the personal circumstances, we don't know who the employer is, what the, you know, what risk assessments they've done, and those sorts of things. I think the best advice really at the moment is for them to contact their official, discuss it with them in terms of, you know, what the offer is and what steps the production's actually taken, and then we can assess whether, you know, there are, you know, the safety measures, you know, in place, and whether they fall under, you know, one of these you know, consultations that's going on at the moment. So I think that's the best advice at the moment, rather than giving a clear yes or no.
Okay,
Thanks.
thanks Spence.
Thanks, Spencer.
Yeah, so if you want to run through them, Jay, and just pick one more, because there's a lot that we've already covered, or do you want me to pick one?
Why don't you pick one? While you're looking through, just very quickly, there's a couple of questions about essential crew and reduced crew, and so Stills are asking about whether they'll still be required on set. I think any processes will need to be worked out by the production within their plan to minimise individual contact. I think the days of a roaming EPK crew on set are probably a little way away, just because it's going to be about minimising interactions between teams. So the way things are set up, and how extra so the stills and EPK and making of that kind of thing work will need to be looked at carefully by its production.
Okay, should we just cover the flying issue? So people who are asked to be engaged in work in international countries where flights are involved.
That's all about following, the productions need to follow government guidelines. Right on, the recommendation is the recommendation of the BFC is that they should be using airlines who are following social distancing rules and safety, and it's all about local requirements, whatever quarantine is involved in. That's much more of a governmental level thing. Unless, do you want to add anything on that, Spencer or Paul?
I don't think so. It is going to come down to, because it depends on what territory they're actually going to. Because, like, you know, we've said, you know, previously, most countries are at completely different stages in terms of this, you know, pandemic. So they've all got different requirements in terms of people entering the country. So it depends where they're going, how long for, and those sorts of things. So I think we just have to have a look at in terms of where they're being asked to go, and then we can provide, you know, what advice we can based on the government guidelines.
Thanks, Spencer. Just before we go on to that last point, Nia, can I just say thanks to everyone for your questions. I'm sorry we didn't get through all of them, including what we managed before the Zoom crash. I think we managed to get through over 100 questions. So hopefully most of you got some of the information that you needed. And I know there's discussions about whether we set up another one of these.
Yeah, exactly. Yeah, there is. So
sorry, Jay, on that, I know that a lot of people will still have questions, and we will be looking at doing another call. But there's one thing I would urge you to do. If you have very specific questions, if you could channel them through your branch wherever possible, if you could get hold of your branch representatives and ask the questions to them. There is a Slack group that branch reps have access to. So often the branches will be able to answer each other's questions, and that might be as good a way of getting an answer to a question as any. I will say that at the moment, our inboxes and the amount of emails we're getting are, I mean, we're each getting thousands a day, and I'm putting my hands up and saying that I'm just not able to answer every email. So if you can channel stuff through reps will be able to share the answers they have, and that'll be a lot more efficient. So if you can ask questions in that way.
Yeah.
Actually, I'm going to jump in. I'm just going to put an email address in the chat box that you can send any burning questions or comments to, and that will ensure that it gets straight to the ADs.
Okay, thanks, Stuart. And also, we are aware that people weren't able to get into this because it just filled up in a couple of seconds with unprecedented demand. So there is going to be a recording of this going out onto the Bectu YouTube channel, and also to it'll be behind the paywall of the Bectu website. But I think we are going to have a discussion after this in terms of setting another one as well, because I do think like there's it's great to give everyone the platform if we can. Okay, Spencer and Paul, do you want to cover the PR situation in terms of the chats that have been going on around wanting Bectu to kind of push that?
Make a statement.
Do you want to read out what the question is, Nia, and Spencer will be able to pick it up?
Well, there's been lots of sections in the chat function just about kind of saying that they want that basically members want to see Bectu push on the PR front in terms of all the hard work it's doing, and also to highlight everything that the union takes a position on in terms of returning to work safely.
Okay, do you want me to pick that up then, Paul?
Yeah.
So just in terms of the PR, we've done some PR already, so if you have a look in, I think it's Variety and some of the other, trade presses, we've already said in terms of the consultation. So we are plugged in and we are involved in terms of the negotiations around, this particular document. And we've, had numerous, internal meetings to make sure that we've consulted and we've fed that back, to the BFC. So we're doing that, and we're making sure that, the rest of the industry knows that, it's an important part in terms of, consulting us. In terms of the issue about returning to work, so there's two things really to say to that. One is that, everyone probably on this call is a freelancer, so they've got a choice in terms of whether they accept or reject in terms of any offers that come in. And the second thing is that we've always said that, we want to make sure that people are as safe as possible if they do choose to return to work. Hence, the work we're doing in terms of the BFC document. The concern I have in terms of people going back where there isn't any clear guidance that's been, accepted or consulted on, by the unions. That's where I've got particular issues, and that's where I'm happy to say quite publicly that people shouldn't be going back where, there isn't any clear guidance in terms of, those safe working practices. I presume that, internally, the BBC have got, guidance, because they have continued to, produce content. They're still doing, news. They're still doing, other work. So they have got internally in terms of, the guidance. Externally, that's the bit I'm have an issue with. So if they commissioned a production to produce a factual documentary, that's where I've got particular issues, and that's where I'm happy to flag up and say they should be covered within the scope of, any guidance that, we actually, produce. And until that's adopted, then people should be cautious in terms of, going back to work. So I think, that's our position. And I'm happy to reiterate that in, any communication. We did put out a circular at the beginning of this week, just to say what our position was and the work we're actually doing, with the rest of the industry. I'm happy to reinforce that message and send out something a bit clearer if people weren't clear enough about that particular position. But that is, as it stands, the union's position.
Okay. Also, just because I know that Andrew is quite vocal on here, and so is Sian. So what we can also do is there's a way in which you can save the chat, so we can share that with our comms team as well, because that provides them with feedback. Paul, do you want to come in on anything?
Yeah, I mean, we're a democratic union. We have a range of branches, and if our branch reps want us to do any joint meetings or issue any statements, that's the way we make our decisions. So if people want us to be holding meetings or to be making statements, things like that, if it comes from our branch reps, Spencer is the National Secretary who covers the London Production Division and the Regional Production Division. And, you know, as a union, we will do what our branches instruct us to do.
Okay. There's also a couple of points about trade press versus kind of
National press.
National press. You know, we can certainly put that back to our comms officers as well. You know, we know that they've been working flat out. So, you know, if that's the feedback that you have as members, then we're really happy to refer that back to them. That's the Louise is saying that's the problem. It's a union led by branches rather than by a direct leadership at the top. Everyone's pulling in different directions.
If any members would prefer us not to be a democratic union, then I'd be interested to see the arguments for that.
Yeah. Shan, I think what's best is that if you you seem to have quite a lot of kind of questions around this, so I would refer them to your branch first, and then that can come up to an official, because I don't think that maybe having those discussions on here is helpful when you have quite specific questions that we're not able to give full answers for because we're not actually in the comms or PR team. So if you'd please do that, that would be really great.
Yeah. Guys, it's a pressing concern. I say we move to get a meeting organised just to discuss it.
Yeah, sure, no problem. Okay, thanks everyone. Thank you so much for joining us. We hope that's been really helpful. As we said, we are going to have a chat now about putting another one on for members that weren't able to access this session. So please keep an eye out for that if you have colleagues who weren't able to make it today. To Jay Lesser, thank you very much. You have been doing an incredible job. So have you, Stuart. Paul and Spencer, thank you so much for joining us. And also to all of the other reps and the activists and the members who have fed into this, who are on the call, thank you very much. It's been an amazing amount of work, and hopefully we can move forward in a really pragmatic and safe way.
Guys, one thing, can I also extend a huge thanks to Jordan Cottress and James Metcalf for helping go with this document as well. Please, they shouldn't be mentioned. And also to anybody from the branches, any branch reps that have also fed into the document. This cohesion and coming together is exactly what we need going forward. And we really appreciate you taking the time to come to us today to ask us some quite grilling questions and also consolidate a position going forward. We should not be returning to work unsafely.
Okay, thanks. We'll just leave it rolling for a couple of minutes just so that people can get things into the chat function if they want, that we can save, okay? Otherwise, bye everyone.
Bye everyone, enjoy the rest of your Wednesday. Yeah, it is Wednesday.
Just wondering, gents, obviously still 106 participants in the room. Do you want me to set up a separate room that we can just jump into to talk about next meeting? Yeah, okay. I'll get off here. I'll send you all an invite now.
Jay, can you include me on that? Stuart?
Jay, hi.
Can you include me on that chat? I wouldn't mind being involved, if that's all right.
On this next meeting.
On Jay's one, yeah.
Yeah, if you stay on, Nia's keeping us on now. I think Jay's had to go.
He's setting up another room, isn't he?
Yeah, I think he's got the other room, but it's just to advise on a second meeting.
Well, Stuart. Stuart.
Yeah, I'm here. What's up?
Jordan has been saying that he wants to feedback on the seminar today as well. He's got some comments.
That's fine. He should feedback to me.
Yeah. Okay. Okay. I'm gonna have to hold on a sec. I think I've got to go on to a different call. I'm afraid I've got a 12 o'clock call I've got to dial into now.
That's fine.
Okay. Cheers. Stuart.
Oh.
Stuart, on this next call, if Spencer's on it again, raise this issue about the PR. What people aren't picking up, and we're not going to say it publicly.
Paul, I'm going to stop you, Paul. There's people still.
Yeah. Okay.
Before you say anything.
Okay. All right. I'll
phone me.
yeah, I've got to go on to a different call. Sorry.